if we can help people to manage their own health, understand what's going on with their bodies and have control of their own data to explain all of that, that's a really good starting point. What we want is good quality health and a good quality life. And so if we can use technology to support ourselves, that for me would be a really big win.
Hello and welcome to WSP's Positive Impact podcast. I'm your host, Lucy Siegle. In this series, we explore the ideas, innovations and voices shaping a more sustainable, resilient and future-ready world. Today, we're asking a question that affects every single one of us. How can technology and digital help us create better, fairer and more accessible healthcare? From smart hospitals to care in the community, our approach to healthcare is being transformed by digital technology. But how do we ensure those changes actually work for clinicians, for systems, and most importantly, for patients? Change is inevitable, of course. And the backdrop to today's discussion also includes an NHS 10-year plan. Among other things, that plan will put a greater emphasis on reducing the pressure on hospitals by treating people in the community at health centres and GP surgeries. What role can and will technology play in this transformation? What are the opportunities and what are the risks? Well, to help us explore this, I'm joined by Cara Williams, Chief Information Officer at the University Hospital Sussex NHS Foundation Trust, and Kevin Sureshkumar, Technical Director in Digital Advisory and a Transformation Specialist for Healthcare and Life Sciences at WSP. Welcome to you both. Shall we get into it? Because we've got a lot to discuss. Well, you're very welcome. And Cara, I think you're our first Chief Information Officer on our Positive Impact podcast. So I hope you take that compliment. So we're completely fascinated. Can you tell us about your role as a CIO working within the healthcare sector? And what are your plans for using technology in Sussex?
Oh, that's such a big question. So my job involves working with data and with technology. So I manage both health records, which originally have been very much paper-based, but shifting them towards a more digital format, and also all the IT systems that the hospitals in combination use. In terms of future plans, we have a strategy for the Trust, excellent care everywhere and an excellence everywhere. And part of that is actually moving to a much more digital way of working. One of the big programs that we've got coming up is an electronic patient record system. So that's something that we're investing in for the next year. So it's a really big move for us.
Okay, there's a lot going on, isn't there? I see what you mean when you said that was a big question. So this has all led you to meeting Kevin from WSP. Kevin, before we get into the detail, tell us a little bit about your background and what you're working on at the Royal Sussex County Hospital with Cara.
So our background is in digital transformation in the healthcare space. So answering the question of how digital enables future models of care and better outcomes for our patients and a better experience for staff in those healthcare environments. And our specialties lie in building the blueprint for how that healthcare organisation exists as an entity. And what that means is whether it's a £1 billion hospital or a community healthcare centre or an existing site, how digital technology and how we use that digital technology and data enables our workforce to spend a little bit more time with patients, focusing on care rather than administrative tasks, and how data can be shared more efficiently. And in that job, what we do is a balancing act. And it's a balancing act between cutting edge innovation in healthcare and in other industries, which we bring into healthcare, and legacy systems, lots of legacy systems, which is a challenge. We have a lot of quantitative structured data that we can analyze and interrogate. And on the other side of the coin, we have tons and tons of unstructured data, which has been historically an untapped goldmine for potential. We do that juggling act and build that blueprint by working hand in hand with clinicians with subject matter experts within the healthcare organisation, like Cara, and Cara's excellent team, architects, healthcare planners, and engineers, in order to describe what technology is used, how we exploit existing technologies, and how our staff and patients are going to be using that technology in order to deliver those better outcomes.
Very good. And so just in layman's terms, can you give me an example of unstructured data?
Unstructured data would be written notes, for example.
Right.
Written notes from clinicians. And it's difficult to interrogate because there's different formats for how it's written. And we can't analyze it readily with traditional tools anyway. That is changing, but that's an example of the unstructured data that exists within healthcare systems.
Which they're famous for being illegible, of course.
Of course.
But there you go. We won't get into the handwriting of clinicians. So, Cara, tell me a little bit about how you're working together and what you're working on.
Well, the Trust serves a population of about 1.3 million. A high proportion of those are more elderly, and cancer is an issue that we need to treat and to tackle within the population. And as part of that, we're a university hospital trust. We are very interested in having a cancer centre that is excellent and brings that excellence in care together. And what I wanted to do is build a digital vision for that cancer centre, working with the cancer team, but bringing the expertise in to work alongside those staff to understand what technology have you got now, in what way does it help, what technology could we be using so that the care that we're providing is the best that we can manage. And the way in which we worked is to be working very closely with that team, so you can really understand how that technology can help. It's not a case of just plug and play technology. I've got a new piece of technology, we just put it in and it works. You have to understand how people need to work, and also the patient journey. So in what way do patients actually come into the care system, and what do we need to do with them along their whole pathway of care to the point where they're healthier, better, can return home. And understanding that takes a high degree of analysis and understanding each step along the way, and understanding what are people doing at that point, how do you relate to the patient, and also what's technology doing to help you. And so analysing all of that gives you a sense of this is the future, and also technology is changing. And so these brand new technologies coming in can do things like managing your building as much as managing the patient pathway. And that's the future that we're moving into. And that's what Kevin was doing, is trying to work with the teams, the cancer teams, to understand what the cancer specialists were saying, what they felt they needed, and therefore what technology we'd invest in to support that.
What are the timeframes that we're talking around here? Because you're saying that technology obviously changes, and yet you're dealing with a time frame that's sometime in the future. So that's a lot of change to manage, isn't it?
It is, but there's always a bit of balance here. So you always deal with what technology have we actually got right now, and you always start there because there is value still in that technology. You need to use it because money has been spent on that technology and it can support you. And so what you're trying to do is almost a bit like Lego blocks, put these new bits of technology together so that you've got the best ability to use the technology in one piece. It's really, it's an art more than a science, I think. And that's what you're trying to do is make sure that for the NHS, you want to have value for money in the way in which you invest in technology. So you won't go for a whole pile of cutting edge technology. You sit quite firmly on the old technology and you move forwards gradually towards the newer. And you might use the really exciting cutting edge technology in smaller parts where you pilot it and see how effective it is before you decide to roll it out. And that's something they do nationally as much as they would do in the trust.
Whether it's an art, whether it's a science, we're used to everyone assuming that a digital transformation automatically leads to increased efficiency and productivity. Is this the case?
So that piece about the art is really important. And it reminds me of a quote from a US economist, a Nobel Prize winning economist, Robert Solow. And he quite famously quipped in the late 1980s that we're in the computer age and we see the computer age everywhere around us, except in the productivity statistics. And what was observed was that there's been a huge push to invest in technology, but the needle hadn't quite moved with the same respect to productivity. And there are many reasons for this, but one of the big reasons is often technology was put on top of processes that were more suited to paper-based workflows. So they weren't quite adapted for that technology and the new tools that we had, and also the workforce aspect. So our workforce wasn't quite equipped and skilled to use the new tools that emerged. So it took a while for us to realise that productivity gain. In Friends, Chandler Bing, he has a job, right? Everyone knows he has a job, but no one knows what he does. Everyone knows he has something to do with computers, but no one knows quite what his job is because it used to be so unfamiliar. But right now, what we've moved into is a world where technology, smartphones, computers, all the data we use is an extension of ourselves. So we grow up with it, we're trained on it, we're more equipped to use the technology now. So we're seeing those productivity gains. And that's reflective in healthcare as well, because there was a big push a few decades ago to digitize electronic records. In the Nordic countries, that was even further back than that. But the dream was we would realize massive efficiencies in productivity and clinicians could spend more time with patients now. But what we moved to, unfortunately, in a lot of cases, is that scenario where you have a patient in the room and a clinician hunched over their computers typing away endlessly, spending half an hour logging into all of their systems, completing endless forms, endless clicks. And that's the manifestation of the digitisation era. Now we're in the transformation era where we're looking at the processes and we're looking at the skills. So we have new systems, we have data digitized. Now we can do that truly transformative piece to enable clinicians to spend more time with patients.
Well, I'd also like to thank you, not just for the answer, but for being the first, I think, guest to reference Chandler Bing in WSP Positive Impact. Thank you for that. Okay, this is super interesting. So it's clear that technology has the potential to transform healthcare, both in the way that we deliver care, but most importantly, improving those outcomes for patients using the services. Cara, give us an overview, if you will, of the different areas where it will really benefit patients.
Oh, I think this is quite, again, another really big question. But if you think about patients themselves, and what Kevin was just saying is that we're becoming inherently more digital ourselves. So I myself, I have a smartwatch. I know how long I've slept. I know how long, how long I've walked, how many steps. It's a bit of an obsession. How many steps did I do today? Have I done enough? So you've got all the way from the patient, if you like, back towards then the services that are available to them when things aren't going the way that maybe they should be. So when something goes wrong, then you head towards the specialists. Those specialists now are being supported by systems that are capturing a lot of data. That data is being used in research to look at, well, what are the trends in health? What are the things that we could be doing to actually treat people in such a way that they get better sooner? And everything in between. So the diagnostic services, the way in which we're managing bookings, the way in which we get people in front of a specialist so they have that diagnosis and a sense of this is the treatment. So all those levels of technology, they're all coming together now, and it's understanding how we do this in a very seamless way. Because I think people imagine that all public services automatically have all the access to the data that they need. So councils and an acute hospital trust where you have your A&E and your GP and your pharmacy, there's this assumption that data somehow is flowing between those organisations, and it's not quite like that. And there's quite a lot of work involved to actually do that in ways that are safe and appropriate, and that information, if you like, can follow the patient. So again, it's a really big question, but the exciting part is how we actually build those technologies so they can knit together, so that in the end, what you have is a person who can manage their own health to the point where they actually need specialist support, and the information can flow with them towards those specialists to help them with their care.
Whilst you were saying that, my phone my watch sent me a message telling me to move.
Yes.
So I really, really get what you're saying. Kevin, what would you add to that?
I think, as an example, One that comes straight to my mind is the use of virtual reality in treatment regimens. And at Hillingdon, where we developed a strategy, we were able to get our ducks in a row. And one of the earliest requirements that came from the stroke team was how we can use technology to aid early supported discharge. So when a funding opportunity came through from the centre, from the new hospital programme, we were ready to go. We built the investment case, the case for change, the requirements and the specification, worked with a virtual reality specialist in the health tech sector to pilot a virtual stroke rehabilitation platform. That pilot's ongoing right now. And it's a great example of emerging technology that's being used to benefit patients, because we would be able to support patients regain movement alongside traditional tools and traditional therapy. But that field is evolving, and it's always evolving. It's a great example of how the march goes on. And the march goes on with personalisation. So there's, I'm going to mention another TV show. A show I've watched recently that's really interesting, something called The Rehearsal. And in the show, the host builds really intricate and elaborate sets and replicas of people's homes and workplaces so that they can rehearse scenarios, difficult conversations that they need to have with loved ones, for example. And that personalisation means that those people can be a little bit less anxious about that conversation that they need to go through. And we can apply that to this virtual rehabilitation scenario as well. What we're seeing is that we're able to replicate the patient's home environment in the virtual reality world. So stroke patients, some of them are supported to go home with occupational therapists to do a home visit. And they risk assess obstacles, access to the home, and build that into their plan and a long-term therapy plan. With virtual reality, we can do that much earlier on in the chain by replicating that home environment within the virtual reality world in the acute setting to complement the virtual reality and therapy stage, and also enable them to receive that therapy at home. So it's a really exciting example of how we have emerging technology, but we keep on going. We keep on looking at other sectors. And we keep on bringing personalisation into the technology and the treatment world.
That's such an interesting example, and you can really understand how that would build confidence with patients who've had this, life-changing condition. So, Kevin, I'll just stay with you for a second, because in the intro, we referenced the NHS 10-year plan and this greater emphasis, which comes from that, on treating people in the community. So is the potential for technology just as big outside of hospitals?
Yeah, absolutely. So with the 10-year plan, there's three big shifts named, which is the shift into the community from hospital, analog to digital, and from the shift to prevention. And we're starting to see the gauntlet being laid down in terms of how is this going to be funded. And historically, in the NHS and the digital transformation world, we've had a very much a feast and then famine situation where there's a very lumpy funding model and it's very short term. And what that means is it's hard to plan long term. But with the 10-year plan, what we're seeing is a long-term investment vehicle, 4-year plans. So we can invest in that digital transformation journey. And what's further encouraging as part of that 10-year plan is there's a real emphasis on exploiting current technology, which Cara mentioned, looking at that productivity paradox, upskilling and training staff, and that change management piece. And that's brilliant to see. With the shift to the community and the health and the high street aspect, I'll mention the high street because when we talk about the high street, we often talk about it in terms of how it's struggling and how they're struggling all over the country. But there's probably light on the horizon in an unlikely hero, which is healthcare. And we're seeing this in that health and the high street model in places like Barnsley, where they've moved acute services out of the hospital into the town centre and shopping centre. And what they've been able to do is drastically reduce the number of missed appointments that patients are having by 24%, which is a big change. And the driver for that is because the care is being delivered close to their homes in town centres. It's easier to be accessed by patients. And then the other side of the coin, it's helping the high street as well because it's increased footfall in Barnsley and the town centres by about 50,000 people a year. So it's a great example of how health on the high street and co-locating services can lead to better outcomes for patients. A key enabler to that is, of course, digital. Working on healthcare community projects, it's very challenging because there's so many different players. They've all got different systems, all got different ways of recording data, transferring data. But if we work out the kinks in that and work out the digital strategy right at the beginning, we can put the star on show, which is the health on the high street model. There's really interesting stories coming out around that health in the high street model, around social prescribing as well, where GPs are looking at holistic health needs. So issues around general mental health, isolation, debt counselling, physical activity as well. So in some of these healthcare centres, a GP would give a social prescription for activity and say to the patient, by the way, one of my neighbours is actually a yoga studio. If you want to, you can go and have a chat with them right now and look at that social prescription right there. It's really incredible how that left shift is working. It really is the future of healthcare in the UK.
Wow. I hadn't even thought of the high street dimension at all. That really is so interesting. Now, Cara, we're talking about all of these kind of, really positive outcomes, but a real challenge, which we shouldn't ignore, is making sure technology is accessible and that people understand it. How do you approach that, and what does it mean for patients?
I think, increasingly, it's been driven by patients themselves. So there are consumables on the market where you can buy your smartwatch and you can track your own health. So I think that the interest is coming from that angle or automatically already.
And there must be a group, I say, outside of that who aren't digitally included, aren't, wearing a smartwatch, maybe don't even know what they are.
Yeah, we've got an example of that where this past year we traditionally produce a lot of letters and print those letters and put them in the post and send them out to people. And we've had a real push this last year to move it to a local portal, a patient portal, which is now is linked to the NHS app. So you can see nationally how the NHS app is becoming a bit of a portal for people to access information. And we've seen a real take-up of that. However, at the same time, we've also had feedback from some patients where they don't want that and they actually want the letter and they have a preference that way. And I think in public service, I think what's useful is if you can, for those people who are willing to adopt and adapt and take on technology, it's a much more cost-effective way, actually, of getting that information to them. But for those people who can't or are unable to do that, then we'll have to adapt our own behaviours and make sure that we communicate in the ways that they find useful and they can have access to it. And in terms of, I suppose, translating health data, some of it's really obvious and straightforward, and there's a wealth of information on the internet to explain some of it. But I think there's also an onus on us as public services to make sure it's translatable so they understand the information being presented to them. And so through the NHS app, through the patient portal, they will get test results. Now, sometimes that will be incredibly clinical and you might need a specialist to translate that for you. But I can see how with time that's going to become more sophisticated and better so that people will understand, am I in the normal range or am I not in the normal range? And sometimes it does require a conversation with a specialist who understands what's happening with you as an individual and to guide you through an understanding of, okay, this is what's happening with my health. These are the next steps that I need to take. And, that's what a healthcare service is for.
It's not just patients, of course. So the NHS employs over 1.5 million people in the UK. How do you ensure that staff understand it?
I think that's a really big topic. There is this assumption somehow that we can roll out new technology and somehow people magically adapt to it. And that's not the case, of course. And so every time we think of some major programs of technical investment, we make sure that there is investment in staff at the same time. It's no point in spending millions in new technology if the staff don't understand how to use it. And so very much like the population, if they have issues with how they use technology, technology, we need to make sure that we provide support to that. And we have an initiative within the Trust at the moment to make sure that we're targeting support towards people and help them with the tools that we're putting in front of them. And also just that continual support, because it's not a one-off, we'll train you once and then you're good. You have to be at their side and make sure that their adoption of that technology is the best it could be. And quite often you'll understand about 50% of it and you'll use 50%, but gradually you can get people to be more sophisticated with the technology in front of them. But yeah, it's definitely something that's worth focusing on. You can't forget the people, because they're the people in the end who provide the care, not the technology.
And there's a good example with digital nurses.
Yes. So traditionally, what you'd have is a corporate IT service. So that's where you had all your, and with apologies to my colleagues, geeks, so all the technical experts together centrally in that core team. But what's been happening now over a number of years is that increasingly you have clinicians, nurses who have, if you like, a combined role. So not only are they specialists in terms of what they do clinically, but they're also developing technical skill. So we have a team of digital nurses who are fantastic, and they do that bit of going out, working with nurses to build their confidence in how to use the technology that's around them. So things like observations, which is something a nurse will do many hours in a day, tracking people's vital statistics. So we have increasingly more technology in that space, but it's making sure that all nurses have the ability to use the technology that's available and just showing them how to use it and building their confidence. Some people will take it up really quickly, some people not so much. And things like patient safety booklets, over the past year, they've been doing work to actually digitize that booklet. So rather than reams and reams of paper sort of hanging around a ward, you actually have it in a digital format now that people can use. So those digital nurses are really an important part of the way in which we're supporting digital skills in the hospital.
Thank you. Also, I think geek is a term of endearment now.
It is. I love them.
Yeah, I take it to be one anyway. Okay. I'm interested, as we get more, adoption of all of the phones and watches and all sorts of smart technology, presumably, is it the case that it gets easier and more normal for people to work with technological change? Are they more receptive to it? Does it stay the same? Or, what do we sort of know now about how we work with people on digital transformation that we didn't know sort of 5 or 10 years ago?
From my point of view, I think what we have to remember, it's not technology for technology's sake. And that's user experience, they call it, or the way in which a patient feels when technology's involved in their care. It's actually really important because it has a psychological impact on people, I think. So from my point of view, it's that they always say it's the triangle: people, process, technologies, the ways in which we work, the way in which the technology is designed, the way in which people are involved in that. It's a really important triangle. And the work we've been doing and the work that we did around the cancer centre and the vision for the future, you're walking around that triangle all the time. And the people are the people who provide the care as much as the patient. It's really important that you have both those perspectives together. I don't know if you feel the same.
No, I'd absolutely agree. That people aspect is the heart of it, and all of the work we do around blueprinting and building digital visions, and the work we did at 3Ts with Cara was those conversations with the clinicians and building what we call personas for the patient pathways and getting into those conversations where we're looking at the emotional journey of patients through a pathway, how they feel through a pathway, how they feel supported if they don't feel supported, what the underlying causes to that. Is it linked to the systems we're using? Is it not linked to the systems we're using? Is it used to the processes? Is it linked to those processes? And then what the staff experiences are. So from all of that intelligence, that's how we build a really robust plan for the future.
We'll come on to what that plan could achieve and the opportunities that it unlocks in a minute. First of all, I just want to stay with people. I want to talk a little bit about their perception of risk, because we read and hear a lot about who's got our data, people's reticence to give over their data. Talk to me a little bit about how you approach that, Cara.
I'll give an example. So recently we tested out, they call it ABT. So it's ambient voice technology. So essentially, technology listening into the conversation between a clinician and their patient. And one of the concerns we had that patients wouldn't like it and wouldn't like the fact that everything they were saying was being captured by technology and was being recorded, and people can get nervous about things like that. So what was really interesting and fascinating about the pilot is that actually patients quite liked it, and they liked the idea that the clinician was actually sitting and talking to them and not focused on a screen and a keyboard and clacking away in the corner without really looking at them. So they actually found the technology interesting and really useful, and we were quite surprised by that. And I think there's a broader picture there as well. So when I spoke earlier of the different public services and this assumption that data somehow just flows between those organisations, there's a deal of work involved in that, and a lot of it is around data security. So each organisation is really clear about its responsibilities around the data that it owns on behalf of that patient, and they have to comply with legislation and show and demonstrate that every year to make sure that they're ready for any, because you will always have the threat of a hacking incident or something happening where data could be breached, but you need to be ready for that and be able to manage that risk. And I actually think that patients in general are actually quite trusting that we are ready and we'll do the best that we can should something happen. So I think that's the way it is at the moment. It's not that it's without risk, but that it's a risk that we manage.
Yeah.
I would say that in the planning of the hospitals that we do, building digital hospitals, the technology is important. We've spoken about that. But one of the most important things is that they're adaptable, and we're able to react to change. And a critical principle of that is that our hospitals, healthcare organisations have to own their own data. So they're in control of it and they own that data. And that means that we don't have situations where we're locked into vendors, because vendors change, priorities change. And if we own our own data, we can adapt in the future. And that's how we build our strategies.
But that does involve a lot of trust, doesn't it?
Absolutely, it does.
Yeah. From the general public. And we do see quite a lot of demographic sort of splintering, so that, younger people give over their data much more freely and they understand the exchange, and maybe older people don't, and stuff like that. So is there still a conversation, an education, a sort of a trust project to be sort of done that's evolving, really?
I actually think for the public in general, it would be a very good topic to have a more broader conversation piece, because you do see, things like Martin Lewis, where people have been defrauded of money because they've handed over their information on the phone to somebody and not realised actually the seriousness of what they've done until it's too late and suddenly money's being drained out of their bank account. So I think there is something about people understanding, the importance of protecting information that protects their data and protects them, in a very much online world. And I think you can see what's happening in Australia, where the government has chosen to step in and protect teenagers, because there is an issue there about how teenagers are online and the things that they can gain access to. So I think it's a conversation that where there is some maturity that needs to be had, and there needs to be an informed conversation, I think, about data being online, how you look after yourself and be careful, and having that sort of intelligence is a really important thing.
Okay, thank you very much for that. Very thoughtful responses. So we're clearly in a new age of technology, and we've only just begun, in a sense, to tap into its potential. So focusing on the potential here, Kevin, give us an insight into the opportunities when we blend the brightest minds in healthcare, of which I think you are certainly two of them, with those in technology. What kind of examples can you give us?
Absolutely, I can think of a couple. So we're very lucky in that in the digital transformation world, there's so much enthusiasm and it's a brilliant community. One example of that is with students. And at Hillingdon, we're supporting collaboration between Hillingdon and the local University of Brunel to host a hackathon. And in this hackathon, the idea is that we were able to condense months worth of idea generation and problem solving and prototype development into a 2-day sprint. So we get the best and brightest students, academics, subject matter experts, plus clinicians in a room together to face some of the wicked challenges facing the NHS head on, get them the data sets and the sandboxes, and they're able to work through collaboratively to come up with solutions, proposals, prototypes, and then pitch them. So there's a lot of excitement around that. We're really excited to support Hillingdon and Brunel on that.
So sandboxing, just explain what that is.
Yes, absolutely. So in a hackathon or when we're developing platforms, a lot of that piloting work, it can't go on in a live environment. So we have a separate entity, which we call a sandbox, where we do that work in. Outside of the hackathon space, it's looking at digital innovation in other sectors as well. And that's something that we're able to do with the wider WSP entity, where we can look at innovation in smart buildings, in digital twins, and we've also been in touch with digital innovation examples from the mining team and the transformation team around projects that could be applicable to the healthcare environment. So within healthcare itself, we're looking at horizon scanning in terms of technology within the UK, worldwide, but also other sectors.
Could you unwrap that a little bit more for me?
Yeah, sure.
So give us a glimpse of what sort of thing you're...
So with the mining team, it was around talking about a platform that was used in natural language processing and how that could be applicable to freeing up clinicians' time in a healthcare environment. And in transport, it's behavioural science. So looking at the behaviours for how people use different transport modes and actually how that's applicable to digital inclusion strategy work that we do. So we've done digital inclusion work at Hillingdon where we looked at the local demographic, how comfortable they are with using digital technology, what the concerns they have with it, what access issues they have with it, and if they don't want to have it, what processes do we need to have in place so they don't have an experience which is suboptimal. And using behavioural science, we can look at that demographic, reach out to them and understand the behaviours and the motivations behind access and issues to accessing digital technology.
So when you think about this and, I kind of get some insight, these glimpses of how things could change, it could be quite fast. And we could be looking, in a sort of near-term horizon at really big changes. But then there's also a lot of constraints, aren't there? So, the age of the building stock and those sort of things. So how quickly do you both think that as, users will really, really start to feel this transformation?
I think from my perspective, I think it's something that's evolutionary. And so what you're going to have, I think, is pockets of change that are being put in as either pilots or smaller scale ways of changing. And if that works really well, then you roll it out further. So I know that we use AI for our diagnostics for radiology, where AI is actually looking through radiology images and identifying which of those slides isn't the way that it should be, and actually highlighting that to a radiologist who can then actually assess it and work out whether that's something where there is a matter of concern, where they need to pick something up with the patient, or whether the AI hasn't quite got it right. But the speed of that is phenomenal. So that's going to change the way in which we do radiology diagnostics, and that's phenomenal. We have robotics in surgery, and the precision involved in that type of working in operations will change the nature of operations. So I don't think it's going to be everything changes overnight. It's going to be all these bits in microcosm that start adding up to an experience where health services seem a lot more effective. And I don't know if you observed the same.
Yes, it is a gradual change. It is changing, which is the good news. And it has to change because we need to be using technology more intelligently to cope with future demand. And we touched upon artificial intelligence, But in terms of artificial intelligence, it's a great example of that. And I think in the US, there's around 800 AI algorithms which have been approved for clinical use. And the vast majority of them are in imaging, so radiology, pathology, types of computer vision to analyze scans. And how those tools work is it's not replacing the human, it's assisting the radiologist. So what we can do, and what AI tools in general can be useful for, is triaging and prioritization. So getting through backlogs and getting through those red flags really quickly. So what these tools can do is flag up instantly, very quickly, the high priority cases and feed them through to a radiologist to review them, which means the next step in the process, which is to get the patient in for a biopsy, can happen a little bit quicker. So we are seeing a big shift. It's gradually changing, but for the better.
Okay. Well, talking of change, this brings us to our special positive impact question, which we always ask. If you could change just one thing to create a positive impact in how we deliver health and social infrastructure, what would it be and why? Cara, I'm gonna start with you.
I'd like to start with people, because I think if we can help people to manage their own health, understand what's going on with their bodies and have control of their own data to explain all of that, that's a really good starting point. So I work in an acute hospital, and it's there really to capture those people who, for whatever reason, they've had an accident, or there's something that's going on with their bodies where things aren't working the way they should and they need specialist support. But you really want that to be focused on those people who really need it. And actually, for all of us, what we want is good quality health and a good quality life. And so if we can use technology to support ourselves, that for me would be a really big win.
Thank you. Kevin?
I think something that I would change is I would get digital involved in service design process or the planning of new infrastructure much earlier. And that's because you would then have people who are looking at the cybersecurity aspect, the data security aspect, the interoperability aspect, the aspect of contracts and different vendors, and procurement, and all those elements relating to digital at the earliest point linked to the model of care. Because if it's not thought about the earlier stages, it can prohibit us in the future in terms of what we're able to do. If we aren't able to change it easily, we haven't really planned for the future. We've just future-proofed the past. But if we get digital in the room really early, we can mitigate against that and avoid some of the pitfalls of the past.
Very well said. If I had a penny for every person who's come on this podcast and said, bring us in earlier, I'd be doing quite well. but no, you make a very, very good point. Listen, thank you to both of you. That was such an insightful conversation. And I really, really appreciate the way that you were able to unwrap and give us, some insight into the developments that are happening, because it's very, very exciting. So thank you to both. That's all, sadly, we have time for on this episode of Positive Impact. Again, a huge thank you to our guests, Cara Williams and Kevin Sureshkumar, and for such insightful and inspiring conversation. Now, if you enjoyed this episode, don't forget to subscribe, rate and share. You can find more information and resources in the episode description. Thanks for listening, and join us again next time as we continue exploring ideas that shape a smarter, greener future. I'm Lucy Siegle, and this is Positive Impact. Goodbye.